Welcome everybody. Thank you for joining this medical talk today with our oncologist, Dr. Alex Siebenhüner. Thank you for joining. I know you're very busy.
Thank you, Peter, for the introduction, also for the invitation to give you my insight and also recommendation what cancer-specific treatment would look like in Switzerland, mainly in our private cancer center here. Yeah.
So we have always a lot of requests, and one of the requests that we very often have is personalized cancer treatment in Switzerland. And I wanted to talk to you to maybe share some of the ideas and some of the concepts that you follow when it comes to personalized cancer treatment.
Right. So first of all, you can't compare the tumor or cancer treatment within the last 5 years because there's so much ongoing, and we know by every week news how to improve our treatment. And this is in the field of personalized cancer treatment here. And what does it mean? So personalized cancer treatment means that at the first step, we will closely look at the characteristics of a tumor, the cancer, as well as the characteristics of a patient. So that means we make a broad analysis, most likely mutation analysis, and look what kind of driver, this is the mutation, could be tackled and targeted. So for that, we find a single therapy for the person and especially to destroy the tumor. So that does not mean that the same person reaches out with the same treatment, one in her neighborhood has been treated. So we make it personalized, individualized, we call it.
Okay, so just let me understand how you do it. So
yeah,
let's assume a patient comes to your center and has a specific cancer. What are the steps that you follow?
Right. So the first, let's say, notes we would like to see is what kind of medical history and what kind of documentation already has been collected. So this is the first, let's say, step we would like to study. And for sure, if some kind of tumor biopsy or tissue is available, we would like to have a second review, because this is important that we do not only follow the paper, we would make a close look on the existing tumor here with our pathologist and deal with him very closely to say what has been found, what should be recommended maybe to add in some kind of analysis. Here we offer a broad analysis, we call it next generation sequencing. This
so most likely genetic one, right?
Genetic, let's say, testing, right? And this compromises about 500 different genes. And within that 500 different genes, if a result is being determined and found, we could speak about a specific treatment.
Okay. And then what is the next step? Let's say you have identified a certain type of tumor or a certain mutation.
Right. At some point, not only one result, maybe 2 to 3 different results have been identified. And now the ranging comes into part. And for that, we deal in our molecular tumor board. So experts sit in that board and discuss what would be the most beneficial treatment here. So what is our first step of recommendation, maybe followed by a second recommendation and a third recommendation. So we make a ranking here. And that would be deal within our international, also molecular tumor board. We also have international experts in that level. So not only dealing with our regional experts, we're also dealing with external international experts, so that we have a global recommendation within these tumor board here.
And you mentioned you learn about new therapies every week.
Yeah.
Was it a bit exaggerated, or is it really so fast evolving?
In some tumor, let's say, entities like lung cancer or ovarian cancer, for instance, there is a lot of going on. And we follow that because I'm also scientifically engaged in, let's say, international groups where we follow, let's say, the recent studies and see what new type of treatment could be offered. Because that is at somehow also, if you look at international guidelines, there are, let's say, recommendations out there. but these guideline recommendations might be outdated because the update has been made in the past 1 year or longer. And in the meantime, we have new options out here. And that's why it's so important to have an international tumor board with colleagues dealing with recent studies and also discussing these recent results to gain the best treatment available for your patient.
Amazing. Dr. Siebenhüner, we don't want these interviews to be too long.
Yeah, sure.
So mostly 5 minutes is something that most people like to follow these interviews. So I would like to stop here. I would like to thank you for your time. It's highly appreciated. And if any of the viewers have questions, please send them to me. I will try to answer, maybe with the help of Dr. Siebenhüner. Thank you very much, Dr. Siebenhüner.
Thank you, Peter.